very dangerous drug hitting the streets. It's called Carfentanil, and it's something that sounds like fentanyl, but it's different. Can you tell us a little bit about this drug?
Yeah, it's a similar analog, but unfortunately it's more potent. We've talked in the past how 2 milligrams of fentanyl could potentially kill somebody. With carfentanil, 0.02 milligrams of fentanyl is potentially dangerous.
Yeah, and you were just talking about how you're not seeing it as much here in El Paso, but in our sister city of Las Cruces.
Right, it's in 37 states, including our area of responsibility, which is West Texas and the whole state of New Mexico. And like you said, we have seen it in southern New Mexico. We've seen samples that were in pill form. In addition to fentanyl, there was other chemicals in there, including carfentanil.
Yeah, and you were just talking about some data too. So since 2023, we have really seen a spike in just people utilizing this drug. Can you talk about that?
According to the Centers for Disease Control in 2023, there was 28 deaths related to carfentanil, but unfortunately it's gone up in 2024 to 238.
And what are some things that you would like the community to know about this drug in order to keep people safe, especially with that tiny dose being so deadly?
Well, one, information, right? If you go to DEA.gov, right there's a picture of the pencil, you know, the famous pencil that has the 2 milligrams of fentanyl, another pencil with carfentanil, and you can see how much less it is. So arm yourself with information, DEA.gov, just click on the photo there of the two pencils and read up on what carfentanil is. One of the things you're gonna read there is that it's not for human consumption. It's a tranquilizer for elephants. So that's what the use is for. But the criminal cartels that all they care about is making money are adding that to the pills that they're selling.
Oh my gosh. How accessible is this drug, you know, for people to get? What are some of the routes that people seem to be taking to access this? Do you know? Yeah,
the majority of the drugs that are sold now, you can find on a mobile device. You know, the cartels are making their sales on applications, especially if they're vanishing applications. They can even make the exchange of funds through, you know, virtual methods. But we want them to know that the DEA is also working those spaces, and we work with the application companies to see the drug trafficking transactions that are happening there. But they're making them as easy as possible for a consumer to access them. And that's what we want to point out today. When you're trying to buy pills, even if you think it's a legitimate pill, which some people do, you need to know that if you're buying it through a social media application or through an encrypted application of some sort, it's very, very, very likely that it's fake. It's not a real medication, and it's very likely that it'll contain methamphetamine, it'll contain fentanyl, or there's a chance that it could contain carfentanil.
And if someone knows someone who, or suspects that somebody else may be using this drug or may have been exposed, you know, what are some steps that they can take to keep loved ones safe?
Well, can I ask you guys a question? Yeah. If there's a fire at your house, what's the 3-digit number you call?
911.
Everybody knows that, right? Mm-hmm. But if we know somebody that's struggling with substance use disorder, which is the technical term for some, you know, we used to call it addiction, right? But it's substance use disorder. It needs treatment like anything else, like high blood pressure, like asthma. So if you know someone who's struggling with substance use disorder, what's the 3-digit number you call?
911. No.
Tell us.
It's 988.
988.
So we need to have everyone know the other 3-digit number, just as we know for where to call for a fire, right? Mm-hmm. 988 will get you 24/7 help for someone struggling with substance use disorder, any mental health issue, or even thoughts of suicide. But a lot of people forget.
Yes, that's also, what I thought too.
Right.
988 I thought was suicidal.
Right.
Yes,
it's
yes.
also for substance use disorder.
That's great.
You can get a reference 24/7, 365. You don't even have to call. You can text the number and they will give you a referral. You don't even have to speak English. Si habla español, they'll give you references in Spanish as well.
And we talk about this often every time you come, but just with numerous things, how important it is to open up the conversation with your kids. You know, we're seeing kids, teens have access to technology way earlier in life now. Is there anything that you want parents to know, a message to them?
Well, the CDC, again, I'm quoting them because they're the experts in these matters. According to the CDC, we lose 22 teenagers a week. And if you think about, most classrooms range between 20 to 30 kids, right? So we're losing a whole classroom a week to these substances. The majority are synthetic opioids like fentanyl or carfentanil, and then about 30% to synthetic stimulants like methamphetamine. So these pills that the cartels are making are killing our young people. But I don't want the public to think just young people are dying. According to the CDC, it's the #1 killer for ages 18 to 45. So it is killing Americans in record rates.
Yeah, and you at the DEA, you obviously raising awareness. You go and speak with a lot of people too about drugs. We were just talking about how you're going to go to Fort Bliss and talk to
some soldiers, right?
Yeah.
At the invitation of the military, they want me to talk to soldiers about the dangers of today's substances. A young E4 may not think, oh, well, there's no harm to this. It's just whatever. But it can be potentially life-threatening. We've had cases, the Fort, we've talked about the fentanyl overdose response team, had to do an investigation when a soldier lost his life to fentanyl. So they're not exempt just because they wear a uniform. And yes, we do a lot of prevention, and we think it's helping. For the first time in several years, we're seeing the number of deaths in our country come down, including in El Paso County, including in southern New Mexico. But ladies, one death is one too many. And so we're going to keep doing the work in enforcement and in prevention.
When we're talking about carfentanil, and I think this is maybe the case for fentanyl as well, do most people even know that they are taking this drug?
I would say no. And again, even if they knew, it's not for human consumption. It's for large animals like elephants. It is not approved by the FDA for human consumption. So even if they did know, which I highly doubt they do, they should not be taking it. It's 0.02 milligrams. It's so little. I really hope everybody goes to DEA.gov and looks at the graphic. Can potentially end your life. And if it doesn't kill you, it leaves you with a terrible substance use disorder that the treatment facilities have told us is really difficult to break.
Well, thank you so much for talking with us, Carl.